What's going on, ladies and gentlemen? Dr. James here, and today I'll be going over useful medical terms that you need to know when understanding your doctor when he talks about your diagnosis, or also this video is very useful if you just want to know how to talk like a doctor. So hopefully we all know what diagnosis means, which is the condition that the doctor is basically giving you based on medical criteria found in the literature. But did you know that there's a little trick that doctors have up their sleeves when they're not exactly sure? So when it's not 100% sure that you have this diagnosis per criteria per se, doctors can basically label the diagnosis to you as a presumed diagnosis, okay? So presumed diagnosis. Diagnosis is, by the way, abbreviated DX many times when it's written down in the health charts or just in medical records. So there's that. But there's also another trick that doctors use when we're giving out a diagnosis that we're not 100% sure what it actually is, and that's called a differential diagnosis. Or if it's many, it's called differential diagnoses. So differentials, pretty much, is what we say. Differentials. And this is labeled DX. So we got diagnosis, differential diagnoses. And these are pretty much other things that could also be the diagnosis, because we're not 100% sure that the diagnosis we're giving you, the presumed diagnosis, is the one. So we got differentials, so like other things that it could be, but less likely.
Dr. Harris.
Yes?
Do you concur?
Concur with what, sir?
And usually when doctors present differential diagnoses, they do it in the order of most likely to least likely, okay? You just bang them out one at a time. I think it's this. I think this is your presumed diagnosis, right? But these are the differentials. Boom, 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 boom. You get the picture. And now, when describing medical conditions, we gotta know if it's an acute condition or a chronic condition. So the difference between acute, not that it's lovely, pretty, all roses and rainbows, although we do like that, but that's not the place, that's not the time. Acute is pretty much the opposite of chronic. So acute, right, is something that happens bang, right now. I broke my arm, something that immediately happened, that's an issue right then and there. Oh, no. Versus chronic, which is a condition that's been brewing up for many, many days, many weeks, perhaps even years, right? So like obesity or a high blood pressure, it's not something that happens overnight. It's something that happens with time. Chronic versus acute, okay? But wait, there's more. So there's actually this thing called acute on chronic. So this is a nice one.
Acute on chronic.
Which basically describes something getting worse in a short period of time, acutely, right? Based off of something that's been happening for a long time, the chronic component. So you can have heart failure, which is your heart not pumping well, and that's a chronic condition. But then you can have an acute heart failure exacerbation, where in that moment, you know, you've been having the heart failure for many years, but then in that instant, your heart just gives way and the heart failure becomes even worse. Also like a COPD exacerbation. You have the COPD for many years, but then something happens that triggers you to have a COPD exacerbation. So it's an acute on chronic condition. And moving on to medical conditions in which you have something that's being treated. You gave the treatment, you gave the adequate medications, and everything seemed to go away, right? But then it comes back. Oh no! And ladies and gentlemen, you may know this, but just for good measure, because we have to be complete, this is called relapse, okay? We're not talking just about like addiction and addiction medicine, although that word is described for those conditions as well, such as alcoholism, tobacco use, tobacco consumption. Yeah, people relapse with addictions, but also this is used in medical conditions like cancer and stuff like that, where things used to be in remission, it went away, but alas, it relapsed. So not good news. You gave the treatment, but then it came back. And last, but certainly not least, one of the most important medical terms that you should know when considering any type of disease, and that is prophylaxis, or prophylactic if using the adjective. This axis becomes Tick if it's an adjective. I don't know if I'm blocking that, but let me know. Anyways, ladies and gentlemen, prophylaxis. So this is prevention pretty much, right? So we can give certain medication as a prevention, as a prophylactic measure, or we could just ensure that people engage in healthy habits to prevent that certain disease, right? Like a healthy diet, regular exercise, right? Like brisk walking 30 minutes 5 times a week prevents you to have a heart attack. That's a prophylactic measure. That's, by the way, free. So keep that in mind, ladies and gentlemen. These are very useful medical terms when just having a diagnosis out there so that you could better understand your doctor, or if you just want to beef up your knowledge and also sound like a doctor when you speak. These terms are very high yield. Highly encourage you to memorize them and put them to good use. Ladies and gentlemen, thank you so much. And as always, until next time.